The pollution, poor eating habits, the imbalanced work-life balance, the stress are some of the major causes for the hair loss in both the men and women. And today we have with us an experienced dermatologist who will discuss about the different remedies and the solutions for the hair loss. With the expert advice, you can retain your hair and look beautiful like before. A statistic says that about 80% of men and the 50% of women will have a major thinning by the time they are 50. Some of them even start losing their hair in the early 30s. So, Dr. Rasya, can you tell us about the different patterns of the hair loss in the men versus women? Is it a genetical cause or any other reasons that cause these differences?
When we start talking about hair loss in general, we are talking about two things. One is there a persistent hair fall or there is a thinning of the hair? Because we see a lot of people who come to us and we say we don't have actually hair fall, but suddenly I feel I am going bald or I am losing a lot of hair. Lot of scalp is visible at that time. So the first thing we want to understand is if it is hair loss or if it's hair fall which is happening, is it something which is very sudden onset or it's very chronic, and then we can differentiate the two. If it is a very sudden hair fall which has started only for say a few weeks, we are trying to find out what happened about 2 months ago, any viral fever, any weight loss, any keto diet, it's all these fashionable diets are there. Whether they changed their house, whether there was any severe stress or they took any antibiotics for any reason, which could trigger a hair fall which is very acute and it is short-lived, meaning it happens for a short period of time and the recovery happens by itself. But when the hair fall is continuous, over a period, multiple months and years it is continuing, this is more common in women because women, they also have their periods on a monthly basis where they are losing a lot of nutrition. And if they're also following any of these fad diets, their nutrition is not coming back. And because of that, they have a phenomenon called chronic telogen effluvium, which is a continuous hair loss process. Coming to the hair thinning itself, so this can happen both in men and women, but it is obviously much more common in men. And like you correctly said, both in men and women, in women after menopause and in men when they turn 40 to 50, we start seeing a lot of hair thinning in up to 80% of them. But what I am seeing in my practice is because of the increased stress, because of the changed pollution, because of the food habits, we are not eating healthy food anymore. These hair thinning, which is like a genetic predisposition, is starting as early as 20s, not just 30s and 40s, but even in their 20s, I have young people coming to me. They've already started getting the thinning on the scalp. So the important thing to understand is that once thinning happens in men or in women, it is very difficult to get the hair thickness back. So always in hair thinning, prevention is better than cure. If you feel that the hair loss has happened for more than 15-20 days, it is time to meet a dermatologist. Don't wait, because there will be so many trigger factors like vitamin deficiency, like hormonal problem, like stress, which we can work on, and we can give the vitamins or we can give the treatment to stop the further thinning of the hair. To grow back the hair, that is another story. I'm sure we will address it in the following questions.